Hi, I'm Chris Harper, and with me is Michaela, and we're here to demonstrate an application for outside knee pain. This is pain located on the outside of the knee, and in this case, I will just indicate where that may be with a red dot. Your pain may vary, though. Okay, and some causes of this may be IT band syndrome, overtraining and overuse, poor training form, or training on hills or stairs. KT tape relieves pressure to reduce pain, relaxes the associated muscles, and may increase circulation. For this application, we're going to place the knee at about a 90-degree angle, and we're going to take our first strip. We're going to fold that in half, and with a pair of scissors, we're going to cut rounded corners on the folded end of the tape. The rounded corners help prevent the tape from getting caught on clothing as you're moving or taking clothing on or off. I'm going to take our first half piece here, and we're going to twist and tear the paper right down the middle. We're going to be careful not to touch the adhesive as we pull that paper back. And we're going to place this on an 80% stretch. So if you stretch all the way and then back that off just a little bit, we're going to put this right over the point of pain and lining that piece up and down the upper portion of the leg or the femur. I'm going to lay those ends down with absolutely zero stretch. So only the middle part of the tape has 80% stretch. The ends have zero stretch. I'm going to take the other half that we created. I'm going to twist and tear just like we did with the first piece, right down the middle. And we're going to apply nice, even stretch on this as well. We're going to align this with the lower portion of the leg, again going right over that point of pain, and peeling the paper off, just laying those ends down with absolutely zero stretch. Okay, and for our third portion, we're going to twist and tear the paper again, this time down by the logo end of the tape. So we create an anchor. I'm going to place that anchor right between the two pieces, or the X that we created. And we're going to remove that paper backing. With this piece, we're going to go right over that point of pain as we lay that down with about a 25% stretch. We're going to bend the tape. What's one great feature about KT tape is that it will bias around corners. We're going to lay that down, again, 25% stretch, but the end of the tape has absolutely zero stretch on it. We're going to give that whole application a good friction rub. That friction creates a little heat. That adhesive sticks much better to the skin with a little bit of heat. And that looks great. Okay, some helpful tips before applying this is to make sure you clean the skin very well, remove any oils or lotions you may have on. Be very careful with clothing as you take shorts or workout clothing on or off, not to roll the tape. It's helpful also to trim the hair off the leg so I have better adhesion to the skin. Some complementary treatments may include rest, ice, anti-inflammatory medications such as ibuprofen, foam rolling, light stretching, and massage. Please seek care if you have severe pain or swelling, or if you have clicking, popping, or extreme stiffness of the knee. For more information, see our website at kttape.com.